Hello, a very good evening, ladies and gentlemen, and especially to all of my dental colleagues out there. As you all know, my name is Dr. Tuba, and my main aim through this channel is to guide all the medical professionals, and especially the dentists, who would like to consider other countries as an option to work in. So my apologies for the delay in the video. The past 2 months have been extremely turbulent for me. But however, all's well now. I had to change the city and the accommodation, but everything has been sorted now. Of course, the new accommodation is not that set up, but with time, of course, I will. But however, regardless of that, I thought that it's high time that the video should be made. Especially the video today is regarding a topic which is a little different, but I got a lot of inquiries, especially from my own country, regarding this topic, which we have to discuss today. So this topic, the video today is about not really for the dentists or doctors, or for the students who have completed their A-levels or their GCSEs and are aspiring to become medical professionals, and especially in South Asia. But unfortunately, they can't get a seat in medical college or in the dental college, and the main reason behind it is the extreme competition and the high merits. Because, like, I'm from Pakistan, so I know it's very difficult to get a seat there because there is a lot of competition, and of course the merits are very high. So there are many students who aspire to become doctors, dentists, medical professionals, etc. But unfortunately they do not get a seat. That leaves them extremely heartbroken, because that was the only thing they thought about. So they did not have any backup option, that if they don't go towards medicine, what else would they go forward to? What else would they go towards then? So this video is especially for that. I do know that many students after the A-levels, if they do not get a seat in the South Asian, in for example in my country, I've seen many students, they opt to go to China, but of course the competition would be high there as well. So today I brought another country where most of the students who cannot get a seat, especially in the South Asian countries, due to extreme competition, they can opt for that country, and that country is Egypt, where you can very easily go, and of course you can complete your medical degree there, dental, medical, etc. So I do know of a medical professional who is actually studying in Egypt, and upon my request he has made a video and also shared it with me. So that video would definitely guide all the medical professionals, all the future medical professionals who would like to continue the education and would like to become doctors, dentists, etc. And if they cannot get admission in their own country, especially in the South Asian countries, for example Pakistan, India, etc., they can always opt towards Egypt. So that is another option, and a country that also encourages international students. That is another option other than China. I will also make a video of China soon, but right now let's talk about Egypt. So over to that dentist, and he would definitely help and guide all the aspiring medical professionals out there, and especially a huge shout out to him, because when I requested him for the video, he has been really fast in actually making the video and giving back within a day or two. So thank you very much for your very quick reply. So now over to him, and I hope this video helps everybody.
Hi there, thanks for that, Dr. Tuba, for allowing me to be on the podcast or show. I'm hoping that I can bring some light onto studying in Egypt for prospective dentists and doctors that want to fulfill their life journey and their life dreams, really, which is something what I had, which was to become a dentist at an early age. I didn't get the opportunity to do it in the UK, and here I am in Egypt now to pursue my dreams, as I mentioned earlier. So I've made a list of a few things that I'd like to cover today. As a bit of an introduction to those that are watching, my name is Naveed. I'm 36 years old, so I'm a mature student, as you would call it, studying in Egypt currently, and I'm in my third year of studies. We just had our exams for our first semester of third year. They went quite well. We have another one to go I think the 12th of this month, and then we should be good to go after that to semester number 2. So just to give you a bit of understanding as to Egypt as a whole. Obviously, the country some people think is one of those third world or developing countries, but it's probably couldn't be further from the truth, to be honest with you. It's a beautiful country, great landmarks, lots to see, a great way of living, and the people are lovely here as well. So we'll go into that maybe a little bit later. I just wanted to explain more so about the course first and foremost. The course is a 5-year dental course with a BDS at the end of it. The 5 years are split into 2 years for preclinical, where you will learn about the theory of oral medicine and general medicine as well. And after those first 2 years, or within those first 2 years, should I say, you will have some handwork involved as well. So in our first year, we had sort of dentition, anatomy of teeth, carving things, for example, drawing things. So you become a lot more familiar with the teeth and the mouth as you go on. Within the second year, you start working on the simulators, and within labs, you'll be working on dental casts, for example. And then you really start to pick up a bit more of a manual dexterity when it comes to things such as holding the contra in the right position, or having the dentist or the operator positioned in the right way, where to have your patient, for example. Once you get through those first 2 years, which can be a little bit tricky, you'll get into the third year, which is a bit of a blend of clinical and preclinical, more focus on the clinical side of things. First semester is again dealing with labs, dealing with simulators as well, but with the focus of the second semester being purely done on patients. So within the next month or so, we'll be starting with our first patients. Very exciting time for us. Something we're looking forward to. So if you are looking to get a license in Egypt to work in Egypt as a clinician, then you would do a 6th year, the imtiaz or the internship. This is basically almost a year's worth of clinical practice only. I believe there may be a presentation or an essay to write at the end of it, or a piece of research, but nothing too extensive by this point. If you want to skip that, take the degree and go back to your home country, you can do that as well, but you just will not be able to practice within Egypt. So that basically covers how long the course is and what you attain at the end of it in terms of a BDS. What to expect we've covered in terms of the theory for the first 2 years, and then the practicals in the second or the next 3 years. People will ask, is it English friendly? The language spoken in Egypt is of course Arabic, which is not an easy language to master at all, I would say. And my parents are Pakistani, so I can speak Urdu quite well. So for me, it's there are some similarities that you pick up on, but at the end of the day, it's still a very, very difficult language to grasp. However, most of the people you'll encounter will actually know how to speak English, or at least to an extent where you can get by. I mean, I'm still alive and I haven't starved to death yet, so it's a good sign. At university itself, most of the students and teachers are going to be speaking to you in English. Some of them get carried away and will start taking their lectures in Arabic, even if you ask for some help in English. But they're always on hand to give you assistance outside of lectures. So if you follow them to their offices or meet them in office hours, they'll be more than happy to help you. The exams are all in English. Any oral quizzes or any quizzes during the year are all in English as well. The reading material is all in English, presentations, everything. So if you have any understanding of the English language, you should be absolutely fine here. The people here in general are very friendly, be that inside or outside of uni, which makes life a lot easier. I've studied in Ukraine before this for a year and a half to 2 years, and it wasn't really anything close to Egypt in terms of standard, and also in terms of the people. I mean, Ukrainian people are lovely, but there is a warmth within Egyptian people, or a way of life where their culture is based around helping people, especially foreigners. They're always happy to hear your stories. So exams typically are done here on a semester basis, and there's 2 schools within most of the state universities here. You have a mainstream school and a credit hour system school, trying to adopt more of a American style here, whereby things are more modular. So depending on which route you take, if you take the mainstream route, which will be at a fixed price, usually a bit cheaper, around $6,000 for a foreign student per year, this route will mean that you will have only finals. So you'll only do end of year finals for each exam. Now the caveat with that is, unfortunately, if you fail any of those, you'll have to reset it in the summer, and if you can fail again, you'll have to redo the whole year. So it is a bit risky. But if you're confident with your studies and your intelligence, then by all means you can take that route. The other route is the credit hour system route, which allows it to be more of a modular approach, meaning if you were to, God forbid, fail anything, then you can reset it in the summer or in following years. And also there are quizzes and courseworks and small little things that add up during the year that make up for the exam, rather than one big final at the end. You have, for example, we have oral pathology, which is split up from the 100 marks. It's split up into a 40 mark final exam, a 20 mark practical exam, which is at the end of the year. And then we have a couple of quizzes in between that, which are made up to maybe 15% of 5%, or 5 marks will be for the attendance. And if I've missed anything out, it'll be the midterm. So there'll be a midterm exam as well, or 2 midterms, and they'll make up the remaining marks as well. So this approach is maybe a bit more easier for those that are looking for a more steady style of study and not too much of a hard graft right at the end. What is the cost of living in Egypt? The cost of living here, I would say, is very cheap. If I was to speak in dollars to make life easier, I think it's a bit more of a universal currency that people accept. If I was to take an Uber from my house or my apartment to my university, which is around 8 minutes away, it's going to cost me maybe $1, maybe less than $1, depending on the time of day as well. But on average, it's about $1 there and $1 back. Food, for example, if I was to order something in, Egyptian food or something grilled, or maybe even a burger and some fries or something, you're looking at anything from sort of $3 to $5 for a meal, which is, in my opinion, quite good, because the food level of quality here is very good. If you were to eat at more of a classic Egyptian style street food place, you're looking at maybe, I don't know, $1 or $half at most to get some nice food here. Egyptian fool, Egyptian dameya, which is falafel. The fool is the type of beans that they use here, which is quite an Egyptian dish they love. So it really depends on your budget. If you're looking to keep it tight and easy to go, you can live week by week on maybe $10, including your travel. So it is a very, very user-friendly or student-friendly country to live in. My apartment, for example, is a 2-bedroom apartment. I am paying here roughly about $200 to $300 a month. I think on average that's about how much it works out at. The entertainment and what stuff there is to do here, there's loads of malls. The malls are beautiful. By the way, I'm from, as I mentioned earlier, from the UK, and I would say that the malls in Egypt are actually better than the malls in the UK. There's a massive emphasis on hygiene within the malls as well, so the toilets and the facilities are very well looked after. There's a lot of hygiene at restaurants. They have very common stores here, like Zara, for example. There's H&M, typical coffee shops like Starbucks and everything. So you wouldn't feel out of place here whatsoever. I'd say the pros and cons of living in Egypt. The pros would definitely be, I feel like I fit in quite well, being of South Asian descent. So kind of blend in, which is quite helpful. As I said earlier, the people are very friendly and forthcoming, especially when they know you speak English or you're not from Egypt and they want to know more about your life, which is nice to have. The cons of living here would probably be maybe the language barrier for those that can only speak Arabic, which aren't a lot. It would be nice to learn the language quicker, but with the amount of studying that you have to do, which brings you on to my next point, makes learning the language a bit difficult. But there are facilities to learn the language, lots of schools, lots of private teaching. The studying, however, here is definitely up to the mark of what I would define as UK standards. You are constantly studying. There is no nice way of putting it. So for those that are looking to come here for an easy ride, I wouldn't recommend it. If you are dead serious about becoming a dentist or a doctor for that matter, you have to have your A game. I mean, this is something that you can't mess around with. You'll have to come straight in, work your backside off, and expect to have maybe 2 weeks off in the middle of the year, and then it's just continuous from start to finish. Maybe September, October you'll start, maybe around June, pushing July you'll finish if you include your end of year exams. It's non-stop. Some people call it hell, but it's what we do to become dentists. In terms of how much it costs, so to apply, you're looking at around about, I think, between $200 and $500 maximum to apply, which you'll need, if you're coming from the UK, you'll need around, I think, 8 to 10 GCSEs at a pass grade, so A to C grades. Within that, you need to have English, maths, physics, biology, and chemistry. And then you need a minimum of a D or a C grade, I'll have to confirm that, at biology A level. Now, those are the minimum requirements if you're coming from the UK. If you're coming from other countries, for example, I remember a friend of mine asked about the Nigerian students coming over, and they said for dentistry it was 70% for their sort of graduation exam, whatever that might be. For doctors, for people that want to do medicine, it's 75%. So I'm assuming that in South Asia and other countries it'll have the same mark. So, you know, if you're coming from India or Pakistan, then whatever the final scores are, they should be at 70% for dentistry, 75% on average for medicine. And again, in terms of the cost, $200 to $500 maximum, I'd say, for the application itself. And then when you go to the university, you will have the two routes, the mainstream route or the credit hour system route. Now, the mainstream route anywhere in the country for foreigners is $6,000 a year. The first year, regardless, you will pay $1,500 on top of this, and then after that it will always be $6,000 every single year. If you are in a credit hour system, you will be paying an extra bit for that service. So we pay on average about 70,000 Egyptian pounds, you can just work that out on Google, per year, and that's basically how much it costs for students to come over and get their education within industry. So the plan is hopefully to finish this all off, another sort of 2.5 years for me to go, and then we'll see where the world takes us. And I'm watching loads of Dr. Tuba videos to find out whether I'm going to be going back to the UK or finding anywhere else exotic to live in. But that's basically everything covered. If you have any questions, I'll put my Instagram here somewhere, and obviously I'll leave my details with Dr. Tuba as well, so feel free to reach out. More than happy to help, and good luck with your studies. Chase your dreams. Thanks very much.